Namaskar, myself Dr. Gaurav Chawda, behalf of MADHUDEEP Ivf Testtubebaby, I warm welcome once again. Today I want to explain what is Testtubebaby or IVF. So for convenience, both names are the same or synonyms. So IVF full form is in vitro fertilization, and popularly or in layman language it is known as the Testtubebaby. So how IVF or Testtubebaby should be done? What is the technique of IVF or Testtubebaby? To know this, we have to first ponder regarding how to we enter in the IVF procedure, or what are the indications for the IVF procedure. So to know, first of all, I want to inform you one name. I want to remember our respected and legendary and revered Dr. Bose, which has first invented this technology in Calcutta in 1970, and he invented this technology and make one child with have the Testtubebaby. It is the world first Testtubebaby in by Testtubebaby, and the proper honor goes to the Dr. Bose from India. Later on, some of the scientists and doctors also made same attempt in the London, in England, and they also successfully completed this whole procedure. Now let's start. What are the pure indication, immediate indication for the IVF? After marriage, without using any contraception, if you are doing a fruitful intercourse, then there may be pregnancy should develop. But in case of some of the reason, like you have a blocked tube, and after operation also not open, then you should go straight for IVF within 6 to 1 year of the marriage life. Second thing, there may be endometriosis, chocolate cyst, or there may be any tumor or cancer. You should go straight for IVF to preserve your fertility. Third thing, there may be a big fibroid at the time of marriage. You should go for the IVF. In some cases, when marriage has completed 1 year and after ultrasound you know that there may be a premature ovarian failure or maybe an ovarian failure, you should go for IVF with the help of egg donation. So these are the absolute and immediate indication after marriage of IVF. Within 1 year of the marriage you should do the IVF. So these are the well-known cause in the female partner, and as you know, I previously repeated it, for making of child both partners are equally responsible, in the 50% in the form male and 50% female. So let's start some of the male indication for the IVF which one should follow immediately after 1 year of the marriage or 6 months of the marriage. So first cause is azoospermia, second cause is necrospermia, and in severe oligospermia after medication, if the result is not get, you should go for straight for IVF within 6 to 1 year of the marriage life. So these are the absolute indication, and some of the indication, like if you done marriage lately in your 40s or 50s, you should go straight forward after marriage for IVF. And in some cases, in second marriage, like if you do second marriage and tubal canalization is done, TL operation was done, and after marriage, if you try to open that tubal ligation is successfully not completed, you should go for the direct IVF. So these are the absolute indication which should be followed within 1 to 6 months of duration of the marriage. Now some of the relative indication. So you should follow your IVF between 2 to 3 years of the active marriage life. So what are they? The most common indication for the second or third year of the marriage life is PCOD. PCOD is popularly known as the polycystic ovarian diseases, in which there are number of follicles are increasing, but the quality and the pregnancy is not developed easily. In that cases, you should follow IVF and freezing. If putting drug, medication, injection, laparoscopy, hysteroscopy, or IVF did not succeed, they all fail, then you should straight for go in second or third year for marriage with the IVF with your freezing. Some other cases are you are repeatedly use IUI more than 4 to 6 attempts, you should go for the IVF. Third is laparoscopy or hysteroscopy is failed, you go for the IVF. All your conservative attempts for first, second, or third year of married life is failed, then you should go for the IVF. Some cases like you have septate or bicornuate uterus, any abnormality, congenital abnormality in uterus, in fallopian tube, ovaries, you should go for IVF. Some of the case in which you should follow IVF for male purpose is if patient having a psychosexual or some other sperm disorder, like patient have oligospermia, patient having some pyospermia, and after 1 or 2 years of treatment, conservative treatment, you don't get the child or IUI repeatedly fail, you go for the IVF. And in some patient, some have a erectile dysfunction or like some have a premature ejaculation in male, you should go for the IVF. So these are the indications. Some are absolute, some are relative. And now we start how we are doing IVF. So for IVF, we use recombinant or highly purified injection, which should be started with the help of pin, and we inject and herself in his body. It is less painful, and after injecting, you get the multi number of follicles. You have to aspirate it with the help of aspiration needle. It is a very low painful procedure, and there is no any scar, any surgery is required. It is given under local anesthesia or under the general anesthesia. After getting the follicle, sperm is collected. Sperm is washed with the help of IUI method. They both put together in test tube or petri dish in the incubator, and 1, 2, or 3 embryo is made, and then with the help of embryo catheter transfer, we should transfer it to the uterine cavity. So that is the whole method of the test tube baby, and this lead to a happy complete family. If you have any problem regarding this, you can direct contact MADHUDEEP Ivf Testtubebaby Hospital. Our number is 97148 64644, and you get the child. Thank you so much. Jai Hind, Jai Bharat, Vande Mataram.